Good evening and welcome to IHW Council's special web series on women's health START, supporting treatment in assisted reproductive therapy. I'm Anisha Nair Thavan and you're watching our exclusive show on women's health supported by Bharat Serums and Vaccines under its Public Awareness Initiative. We are currently seeing the COVID-19 second wave in India a year after its outbreak. This is just a reminder that we cannot put our guards down and we have to ensure masking, washing hands, and social distancing. This is also a reminder to put our health before anything else. The arrival of the vaccine, the start of the inoculation process, and the lessons from last year have brought hope to millions who want to stay safe and bring about a semblance of their pre-corona days. But there are many who find themselves in despair as some of their dreams have suffered a setback because of the many restrictions of the lockdown and the fear of COVID-19. I'm talking about couples who dream about starting a family but are unable to do so because of infertility. Infertility over the years has emerged as one of the most common health issues that many young couples have been facing. According to the Indian Society of Assisted Reproduction, infertility currently affects 10 to 14% of our population, and the scenario is worse in urban areas where one in every six couples is impacted. Now, our show is special as we're going to talk about all aspects of fertility and IVF treatment. Bharat Serum and Vaccines Project START is an initiative that aims at providing support to couples beyond medicines with initiatives like microfinancing the treatment and counseling. Project START encourages couples to stay on course for IVF treatment and achieve their goal of parenthood. And today we're going to talk about the role of hormones in IVF and fertility treatments and the recent advancements that are taking place in the science of IVF and what we can expect in the years to come. On our show, we have an expert joining us to help answer all your questions as well. So make sure you use this opportunity to ask questions if you have any. Please welcome Dr. Sunil K Jindal, Scientific Director and Chief Endo-Laparoscopic Surgeon and Male Infertility Specialist at Jindal Hospital and Madhu Jindal Memorial Test Tube Baby Center in Meerut. Welcome to the show, Dr. Jindal.
Thank you very much. Such a pleasure to be here, Anisha.
Just a quick introduction, Dr. Jindal. He's the Vice Chairperson, Delhi, of the Indian Society of Assisted Reproduction. He's also the Vice Chairperson of the Indian Association of Gynecological Endoscopists. He has vast experience of over 5,000 cases of laparoscopic and hysteroscopic surgeries. He has special interest in microsurgical, endomicrosurgical andrology, and surgery for impotence. Now, before I begin our conversation, I would request all our viewers watching in, this is your golden chance to ask your question from such a renowned doctor who's also doing a lot of, he's up to speed with all the latest in the IVF treatments as well. So if you have any questions, please type it in the comment box. And just a request, if you are sending us a question, please give us details about your age. If you're asking questions, PCOD or AMH, please do mention the particular conditions you have and your age so that the doctor will be in a good position to answer all your questions. Do like and comment with your feedback as well and share this page with people who you think they benefit from the conversation we're going to have. So let's begin, Dr. Jindal. Now, my first question to you is about, hormones. Why are they so important? Because, when somebody is trying to conceive and then they go and meet a doctor to try and figure out what's going wrong, first thing they're told is do some blood work, which involves a hormone profile. And then, sometimes your FSH is too high and, some people don't really understand what it means and why is it so important? Could you explain to people watching?
I would be speaking in English as well as Hindi,
Yes,
because
sir.
we're going to have both the people together. Now, let us first of all, just like you rightly said, our country has about 10% of population who don't have children. And out of these, about 50% of the contribution is by the men and 50% by the women. So it's the largest size of population in the world. In fact, about 1.5 Australias is the number of people who don't have children. Now, the question which you have asked now is the hormones. So what does a woman need? A woman needs to produce good eggs, a good endometrial lining, and a uterus which is conducive to accepting a baby. Now, all these three things are managed by the hormonal profile and the hormones in the body. So the woman has one main hormone known as estrogen, and there is another hormone known as progesterone. The cyclical flow of estrogen and progesterone leads to the menstrual cycle and the making up of the lining of the uterus. So your egg formation depends on hormones. Your lining, which is going to get the baby inside it, जो बच्चे को basically ग्रहण करेगा, वो hormone पे dependent है. So पहला test which is normally done in a woman is going to be the testing of the hormones, which normally is FSH, LH, prolactin, and some markers of hormonal profile like AMH. अब क्या क्यों कराते हैं हम AMH, FSH? अगर AMH बहुत लो आता है और FSH बहुत हाई आता है, it means your egg formation is poor. And the other thing is we also need to know this, क्योंकि IVF के अंदर जब हम इंजेक्शन हॉर्मोन्स के देते हैं तो हमें एक कैलकुलेशन करनी पड़ती है कि हमें आपको इंजेक्शन देने कितने हैं, जिसकी बेसिस पे हमें अच्छे अंडे मिल सके. Now when it comes to the male, a man makes sperms, millions of sperms, out of which one sperm is going to go and make the egg. Now, which is that lucky sperm? Nobody knows, but you need to have millions of sperms. And to get these million of sperms, you need one hormone which needs to be okay, and that is your testosterone. The testes will only form sperms once the testosterone is fine. So we need a hormonal profile of the woman and we need a hormonal profile of the man if the sperms are less, so that we are clear how we need to treat them further.
राइट. डॉक्टर जिंदल, पर कभी कभी ऐसे होता है ना कि हमारे हार्मोन्स भी ठीक होते हैं और फिर भी कठिनाई आती है. तो एक चीज़ हमें समझना चाहते हैं कि जिनकी हार्मोन रिपोर्ट ठीक नहीं आती, उन्होंने क्या किया है कि उनकी रिपोर्ट ठीक नहीं आती. तब अपने हार्मोन्स को हम कैसे पूरा साइकिल डिस्टर्ब कर देते अपने आप, अगर हम ऐसे करते हैं. और जिनके हार्मोन ठीक आते वो फिर भी नहीं कंसीव कर पा रहे, फिर और क्या कारण हो सकता है?
देखिए एक बात को समझिए, ये सिर्फ हार्मोन नहीं है. हार्मोन तो एक छोटी सी चीज है पूरे सिस्टम की. रिप्रोडक्टिव मेडिसिन मतलब एक वुमन के अंदर, चलिए पहले मैं वुमन की बात करता हूँ. एक वुमन के अंदर क्या चीज जरूरी है? एग्स अच्छे बनने. एग्स अच्छे बनने के लिए हार्मोन्स ठीक चाहिए, ओवरी ठीक चाहिए, यंग चाहिए. जितनी ज्यादा एज बढ़ेगी उतना मुश्किल होगा एग बनाने में, पहली चीज. दूसरा चाहिए दो ट्यूब्स जो खुली हुई हो, जिनमें कोई इंफेक्शन ना हो, क्योंकि बेसिकली अंडा उन ट्यूब्स के अंदर जाएगा और स्पर्म ट्यूब के अंदर मिलेगा इस अंडे से. तो हमको चाहिए ट्यूब अच्छी. तीसरा हमें क्या चाहिए? तीसरा हमें चाहिए कि जो यूट्रस है जिसके अंदर बेबी पनपेगा, उसके अंदर की लाइनिंग, विच मीन्स द एंडोमेट्रियल लाइनिंग, दैट नीड्स टू बी गुड, हेल्थी, वांटिंग टू एक्सेप्ट अ बेबी, डिजीज फ्री. अब हमारे कंट्री में, फॉर एग्जांपल आपने सवाल पूछा, हमारे कंट्री में ट्यूबरकुलोसिस इतना ज्यादा है, और ये ट्यूबरकुलोसिस इतना ज्यादा है कि यूट्रस लाइनिंग के अंदर ये जब इन्फेक्ट कर देता है तो परेशानी देता है. आपको एक छोटा सा वाकया सुनाता हूँ. I go a lot internationally to present papers, speak to people, and it was about 15 years back. I still remember. I was a young man. I still am, but at that time so I had gone to the US, and I met a very famous doctor over there, Dr. Salim Daya. So I got down to speaking to him and I said, what do you follow for tuberculosis? So he looked at me for a minute. He said, you should be telling me this because I have never seen tuberculosis. So if you ask me this thing, otherwise, there are these infections which are there because of you can't have a baby. And 50% of contribution is done by the man. हमारे यहाँ सबसे बड़ी समस्या क्या होती है कि हम ये मानते हैं कि ये प्रॉब्लम विमेन की है, विमेन सेंट्रिक है. और सच ये है कि आदमी 50% कंट्रीब्यूट करता है. 50% मेन के सीमन में इन्फेक्शन हो सकता है, हार्मोन आदमी के बिगड़े हो सकते हैं, स्पर्म का क्वालिटी खराब हो सकता है. और आज के दिन में जो सबसे इंपॉर्टेंट चीज है, दैट इज द डीएनए ऑफ द स्पर्म एंड द डीएनए ऑफ द एग. नाउ इफ द डीएनए ऑफ द एग एंड द डीएनए ऑफ द स्पर्म इज नॉट गुड, कितने ही आप अंडे बना लें और कितने ही आप स्पर्म बना लें, बेबी पैदा होने में दिक्कत होगी। तो बहुत सारी चीजें हैं। और पुराने जमाने में 15% women unexplained infertility बोलते थे, which means you could not diagnose why do these women not have children. And today this 15 to 20% has reduced to about 5% because the advancements which have happened, they have led us to diagnose what is the problem.
Right. So, डॉक्टर जिंदल, ज्यादातर तो हमारे सवाल भी होते हैं तो पीसीओडी और सिस्ट और इस चीज के बारे में होते हैं। अब थोड़ा सा हम मेल infertility के बारे में बात करते हैं, since you're a specialist there. Now, you said 50% of the problem is because of the man. Now, what can be done? If there is a problem, can it be fixed? For women, you said if the tube is not right, you could try to fix it, or you could just bypass the tubes with an IVF. You could try to see that, you stimulate the woman with hormones that she makes good eggs and more eggs. How do you overcome whatever limitations may be in the male side? Can it be done?
It's a fantastic question because women rush to get a baby and males don't come into the clinic to get a baby because most of the people believe that the man is fine and the problem is with the woman. Now, I'll give you some statistics. It's interesting. If 100 couples don't have a child, in 30%, the man has a problem. In 30%, the woman has a problem. And in 40%, both have a problem. So which means it comes to 50% in this fashion. If there is a very fertile woman and the man is partially subfertile, she can carry him on. And similarly, if a man is extremely fertile and the woman is mildly subfertile, वो अपने कंधे पे ले जा सकता है उसे. But for the man, there are a couple of things which can happen. First is the quality of the semen and the sperm. So the sperm can be poor in quality, less in number, sperm may be less motile, and the sperm may be having an abnormal form. But now there are a lot of papers which have come out. In fact, I have been a part of one of the largest studies in the world across the continents on sperm DNA fragmentation. So what happens is that even if the sperm count is normal and the DNA fragmentation of that sperm is there, that sperm, despite the number, is not capable of producing a child. मतलब ये ऐसा हुआ कि एक फौज है, फौज के अंदर 100 जवान हैं, 100 जवानों में से सिर्फ फौजी 50 हैं, तो 100 की टुकड़ी नहीं हुई, 50 की टुकड़ी. Similarly, so the DNA fragmentation of the semen, when it's high, it leads to a situation where despite a normal semen, it is there. Now, what can we do? Now, I'll talk about what can you do and what can I do. So what should the patient do? So the first thing is, patient को अपना weight कम रखना है. जितना ज़्यादा obese होगा, उतना खराब sperm होगा. In fact, according to the latest statistics, obese people with a very high BMI have 2.5 times less chances of having a good sperm. Number two, the diet which you take has to be with antioxidants, hari sabziyan, green vegetables, fruits, less of carbohydrate, less of saturated fatty acids. Third, you need to take less of tobacco or no tobacco at all. आप स्मोक करते हैं, तंबाकू खाते हैं. हिंदुस्तान की एक खास अदा क्या है कि स्मोक नहीं करते लेकिन तंबाकू खाते हैं. तो फादर को भी दिक्कत नहीं होती बेटे से तंबाकू मांगने में, सिगरेट पीते नहीं थे बाप के सामने. So the situation is even tobacco which is eaten leads to a poor sperm count. Next, what you can do, not having infections, which means try to avoid multiple sexual partners. Sexual infections lead to a bad sperm count, lead to DNA fragmentation. Now, apart from that, the pollution, the way it has increased, the mobile radiation, the way it is, the way our food, air, everything is polluted. polluted. The sperm count over the last century, in fact, in the last 30 years, has declined 50%. Luckily, it is above normal, and therefore, at the moment, hahakar nahi bacha. But if it goes on in this fashion, it won't be long before the sperm count goes down below normal for us to have a fertility problem just like any other problem. So these are the things which you need to be doing, but you need to be diagnosed what is the problem. If there are less sperms, you can be treated medically to have better sperms. If you have no sperms, then sperms can be given after retrieval from your testicles. We can take out sperms by a procedure known as TSE or micro-TSE from your testicles, take out the eggs of your wife, inject each egg with a sperm by ICSI, have baby, do a human tissue culture, have babies, place them in your uterus, and you can have your own babies. So earlier what used to happen was you used to say, well, I've seen the movie Wicked Donor. I don't have sperms. The only way I can have my baby by a donor sperm. No. 70% of azoospermics can have their own baby. It's possible to have your own fatherhood in 70%, even if you don't have a sperm. And you know what is the percentage of people who don't have sperms, Anisha? 1% of you. 1%. But the fact remains, those who don't have sperms don't tell the other person, I don't have sperms. So a person who doesn't have sperms, he feels he's the only one who doesn't have sperms. So when they come to me, I normally tell them, 1% of population doesn't have sperms. So you're not the only one. Have you told anybody that you don't have sperms? They said, no. I said, nobody says that they don't have sperms. So they will not come to know about it. And the third thing is, there's a 70% chance you can have your own baby. This is the cutting edge technology of IVF, which I was talking to you about, micro-TSE. So in IVF, normally what we do is we take sperms, mix them with the eggs, do a tissue culture, make babies, put them in the uterus, so that the uterus takes up those babies and you have a baby. Right?
Right.
But then the advancements which have happened over the last couple of years in IVF have not only increased the success rate, they have been able to give us healthier babies, and they have been able to give babies to those people who initially could not get babies with IVF. So it's an interesting journey, the way it has happened from the time of Louis Brown.
Really?
Louis Brown, the first test tube baby, also has a baby now.
That is great. It is the miracle of science that brings hope to a lot of people. But Dr. Jindal, आप बात कर रहे थे DNA fragmentation की. DNA तो हमारा inherent होता है. We are born with our genes, right? So you're saying that DNA fragmentation is there. Is it because of lifestyle? Can that happen? And can it be fixed medically?
How do you get such great questions, Anisha? It's fantastic. It's a very important question. See, DNA is the basis of everything which we have in our cells. That is the basic code, the basic coding on which we breathe, our proteins are made. And gametes means egg and sperm. Both have DNA. And the whole story is the DNA of the mother and the DNA of the father meet each other. Both as a DNA make an embryo. The embryo goes into the uterus, grows, and the baby comes to life. Now, if the DNA of the ovum or the DNA of the sperm is defective or is fragmented, either pregnancy will not take place normally, and if pregnancy takes place, the chances of abortion will be very high. Now, the question is, can we do something about it? Yes. DNA fragmentation can be managed in the male by antioxidants, a healthy lifestyle, proper weight, good fruit-based alkaline food, less polyunsaturated fatty acids, no smoking, no tobacco, no marijuana, no drugs. And apart from that, this DNA fragmentation can improve if the pollution goes down. Now, I always tell my patients, I'm going to give you a list of things which you have to do, and I'll do my part of giving you medicines. But what you do is equally important. So the DNA fragmentation can go down with the healthy lifestyle. The problem is the pollution. What will you do of this pollution? The problem is the, I would say, जो खाने में मिलावट मिलती है. What will you or I do about it? What can we do about the mobile waves? What can we do about these infections which are everywhere? In fact, there's very little we can do. But yes, a healthy lifestyle is the answer for this.
All right. I hope people get that message because most of the doctors who do come on our show do recommend a healthy lifestyle. Dr. Jindal, we started getting a few questions from our audience. There is a Facebook user who is saying, I'm 42 years old. I have a 10-year-old daughter. I'm trying to conceive for the last 6 to 7 years. Less egg formation, thyroid and BP problem. Left fallopian tube is blocked. Please suggest. So she seems to have a secondary infertility problem, and she also has thyroid and BP problem. Left tube is also blocked. What would you suggest she do? She's 42.
If your wife is 42, so one thing is clear that her egg formation naturally by age would be low. I mean, ये प्रभु का डिजाइन है कि इंसान को बच्चा पैदा 30 साल से पहले करना है. 30 साल के बाद अगर आप कोशिश करते हैं तो बेबी पैदा करने में दिक्कत इसलिए होती है बिकॉज एग फॉर्मेशन डाउन होता है. अंडे अगर बनते भी हैं तो बहुत कम बनते हैं और अच्छे नहीं बनते. सो पहली चीज तो एट द एज ऑफ 42 देयर इज अ चांस दैट द एग फॉर्मेशन इज गोइंग टू बी डाउन. द सेकंड थिंग, if one fallopian tube is blocked, then there is some infection because of which the tube is blocked. Tube अपने आप तो बंद होती नहीं. And normally the infection is there in the uterus, it would have affected the other tube too. So she needs to be investigated for any infections which are there in the uterus. And if those infections are there, they need to be treated, number one, so that those infections are out for a baby. And the second thing is, it has to be judged whether you can have an IVF. IVF, why? Because egg formation is very bad. Whether you can conceive naturally or with an IVF, or if with an IVF at the age of 42, whether you can make your own egg or whether you will have to have a baby with a donor egg.
Okay. Dr. Jindal, we have another question from a user who's asking, a Facebook user, what is the success rate of implantation of 8-month-old frozen embryo? How to increase the implantation chance? This is my first cycle. I had in my first cycle, in my first transfer, everything was good. Lining was more than triple. PRP was also done, yet the cycle was not successful.
See, one thing we need to understand, and I always tell all my patients, इस काम में 3 पार्टनर हैं. You are the player, I am the coach, and the result is given by the Almighty. So first thing is, और ये मैं सच कहता हूँ, ये जो हम अपने हाथ से करते हैं ना, ये प्रभु की मेहरबानी है कि प्रभु हमारे थ्रू ये काम कराता है. इनफैक्ट एक बड़ी इंटरेस्टिंग चीज कहूंगा आपसे. मैं एक चीज को बिलीव करता हूँ कि अगर आप मेरे पास आए हैं तो ये प्रभु की मेहरबानी है कि मेरे हाथों से आपका काम कराना चाहते हैं. Now, the chances of implantation depend on 3 things. They depend on your uterine lining, they depend on the quality of your embryo, and they depend on the rest of the things which are being done in that particular cycle. For you, the drugs which you've been given, the way the transfer has been done, I mean the technical things. Now, if your endometrium is triple line, which is great, and you still have frozen embryos, which means you had extra embryos which have been frozen for you, which I'm sure must be good, then it does not matter whether they're 8 months old. They're not 8 months old, actually, they're fresh, but they are frozen 8 months old. So the chances are always all over the world between 30 to 50%. It is not more than that. The best of centers in the world have success rate between 30 and 50%. So if anybody says more than that, well, they need to train people.
Right. Dr. Jindal, I will ask you a question from my side. Given this question that has come that, when everything seems to have been done well, the implantation hasn't happened. In our previous show, Dr. said कि जो implantation है और baby है वो भगवान के हाथ में है. But is there any investigation that can be done? Do you think the immune system has any role to play on how the body accepts the embryo? We hear of autoimmune cases where the immune system attacks your own cells because it doesn't recognize them as your own, but it's foreign. But an embryo is foreign because it has DNA of your husband. So could you investigate there? Could you somehow improve the chance of implementation?
Yes. Good question. Good question, because it's important. So we need to understand two things, and I'll give you a very, very simple example. If a husband and a wife have no problem, they are young, they are teeming with energy, they've just got married, and they say, wow, we want to have a baby right away, and they have intercourse the whole month during the fertile period, the chances they're going to have a baby is 12%. It is not that you can calculate the birthday of the baby from the birth of the baby 9 months back, the shadi ka date. No, you can't do it. You cannot do it because the implantation is about 12% only. So what happens in IVF? Even if the embryos are good, even if the lining is good, the implantation and the chances of implantation are not 100%. Why do we transfer 3 embryos? With the idea that at least one is going to stick on and be implanted. So implantation is a natural process where the endometrium opens, gets the embryo on its own, and gets it stuck and grows it. So अब ये क्या है? अब इसको आप nature अधीन कह लीजिए, इसको आप प्रभु अधीन कह लीजिए, but this is a natural process. So this is something to get. Now, what can we do to improve it? So there is a test known as an ERA test. So if we do that ERA test, we come to know if the window of implantation, which means what is the best time to keep the baby within your uterus when the implantation window would be the best. That can be judged by a test known as an ERA test. Apart from that, there are a lot of tests which have come as immunological tests, but let me be honest to you, they still are in infancy and they still have yet to be proven that, well, they're going to help and tell us much.
Right. We have another question, Dr. Jindal, and this is from Facebook user. She's saying, I'm 32 years old, my husband is 35 and is suffering from low count and slow motility. Is this the time to take a call for IVF? Is IVF required in this situation?
If the count is low, get him examined by an andrologist, good andrologist. Low count could be infection, could be varicose. Treatment of both of these could improve the motility. If the count is low, he needs to be checked if the hormones are okay or not. In case of a low hormonal level, by giving hormones, at times the sperm count can be okay. Fine. However, in case both these things are fine and it cannot improve, if the sperm count is very low, then IVF is not the answer. The answer is ICSI, intracytoplasmic sperm injection. So with very low motility and low sperm count, ICSI is a boon. It's magic. Let me be honest. The people I met the Dr. Palermo who did ICSI the first time. और उस दुनिया में तो खैर चरण नहीं छूते तो चरण छूने की बात नहीं थी. But I wanted to do that because of the prime reason that that single man who discovered ICSI and taught the whole world has given birth to oligospermic men, azoospermic men, poor sperm counts all over the world, millions of children, I think, by now. So you can have your baby by ICSI, that's not a problem, even with a poor sperm count. See if it can be improved, that would be a better idea.
But Dr. Jindal, ICSI is also like IVF, right? If the baby is still in a...
See, in IVF,
If the baby is still born in the lab, the woman will still go with the cycle, right? That is the same. Only the sperm and the egg don't meet naturally. That's the difference, right?
Yeah. The difference is in IVF, you wash the semen, take out the sperms, mix them with the eggs, with the idea that the sperm is going to enter the eggs and fertilize. In ICSI, you denude the covering of the egg, hold the egg, take a single sperm in a micropipette, inject it into the cytoplasm of the egg, and fertilize them. So you're getting a place where the sperms, if they're poor, if the egg quality is down, to get a fertilization for sure.
All right. Dr. Jindal will take a last question, and this is from a Facebook user who's asking, after unsuccessful IUI, should we wait for a few months or should we immediately go in for an IVF?
What's your age?
Those details aren't there.
They're not there? If you're young, your tubes are open, sperm count is fine, go ahead and plan 3 to 4 IUIs. Not a problem at all. You may get pregnant with an IUI. So why not give that chance? If your age is low and the egg production is not so good, and you feel that you've tried for long enough, go ahead for an IVF.
All right. Dr. Jindal, thank you so much for joining us today, answering all the questions that you have answered of those viewers who have sent in their questions, and also enlightening us with all the latest developments in the entire science of IVF and how we can help ourselves to remain in tip-top shape so that we can also give a fair chance to reproduction on our own. Thank you so much for joining us.
I would like to thank you very much, Anisha, for conducting this beautifully. And I'd like to thank my audience and like to thank the people who joined it. I think thank you very much for being here, for taking out time, because this is time well spent, because I honestly feel by your being here, there is something which you must have got, which I'm honored. Thank you very much.
Thank you, Dr. Jindal. So, Dr. Jindal answered so many questions related to fertility and IVF treatment during COVID-19 in our show today. If you have more questions, you can send them to us through our WhatsApp button, which you can press on our Facebook page and type in your questions. We will try to take up in our subsequent shows. Don't forget to follow us and stay updated on all that concerns your health and well-being. This program was supported by Bharat Serums and Vaccines Limited under its Public Awareness Initiative. We'll be back again with a special show on women's health, same time next week. Do keep sending us your questions and we'll try to include them in our next show. Till then, stay at home, stay safe and take care. Goodbye and see you soon.